The next diagnostic test that I like to use is a test called the Ligamentum Teres test, and this was a test that was published by John O'Donnell and colleagues. And so with this test, it's meant to have the hip in a loose pack position, so that what we're doing is we're not loading any of the rim structures, so we can be confident that we're not loading up the labrum or the cartilage on the rim, but instead we're loading up the ligamentum teres, which is an intra-articular ligament that comes out of the head of the femur and has an anterior and posterior branch that come and attach into the anterior and posterior part of the acetabulum on either side of the transverse acetabular ligament. So for this test, what we're going to do is we want to go very much into a middle range of motion. So what you do is you take the patient up into full range of hip flexion, and then you come back halfway from there. You then drop them out into full range of abduction, and you come back halfway, and then supporting their knee, just let the hip roll around, and it should feel really, really loose and shouldn't cause you any problems. And then for the test, again, it's a pain provocation test where we can load into internal rotation in that position. Does that cause any pain? And then we can also go into external rotation in the same position. Any pain there? And what we're looking for again is both positive and negative tests. This test actually has really high sensitivity and specificity, so that if the test is negative, we can be confident that Georgie doesn't have ligamentum teres pathology. If the test is positive, we can be reasonably confident of diagnosing ligamentum teres pathology. So it's one of those rare tests that actually does have high sensitivity and specificity.